tell us the story of the first patient that you recommended the diet to?
Oh, well, I've got many first, but one that really stands out to me. And this was a gentleman that came in. And, in my practice, I should say, I've got nearly 3,000 patients. They don't register with me because they want to know about plant-based nutrition. I'm a general family medical practitioner. They register with me for anything and everything. And you never know what's coming through the door. People don't pay for their care at the point of service. In general, there's no insurance sort of for that. So literally anything and everything. You become not only a medical doctor, you become a counselor, you become like a friend. Sometimes you sometimes take the place of a vicar, I guess, in a traditional, or a priest in a traditional society, because people, don't have those people in those roles anymore. So you never know what people are going to come in with. And he sat down and he slumped and he looked utterly miserable. And he turned to me and he said, "Doctor, I've been sent home from work and I've been told not to go back." I didn't know what he was talking about and why. So I said, "Oh, gosh, what happened? Did something happen at work?" And he said, "Yeah, I had an on-the-spot medical and they told me that my blood pressure was too high. And because I have to drive large lorries as part of my job, they revoked my driving license and told me that I needed to get this sorted out. Otherwise, I wasn't able to go back to my work." And I looked at him and he looked completely distraught. And I realized that for him, his job was so important and we needed to get this sorted out quickly. And he said, "What can I do, doc? I'll do anything." And I said, "Well, usually we would need at least 3 different blood pressure medications in combination to get you to a level that you are wanting right now," because his blood pressure was sky high. It was in the dangerous zone where you'd worry about things like having a stroke. And we didn't want that. So I said, "Look, we're going to have to start you straight away on some medication. We're going to have to bring you back every few days over the course of a few weeks to really try and get this under control." And he said, "Well, what else could I do?" And I said, "Well, there are lifestyle changes that are really important." He said, "I don't want to be on tablets for the rest of my life. I don't want to take blood pressure tablets. Is there anything else I can do to stop myself from having to take tablets?" And I said, "Well, I can't guarantee, but there is something else you can do." And I was really nervous about talking to him about this because he's from South Africa. And I knew that he was very much somebody like most South Africans that enjoyed their meat. And so I said, "Look, you could consider going on a completely whole foods plant-based diet." I'd read some research around some of the benefits of things like beetroot for opening up the blood vessels, hibiscus tea for doing the same, flax seeds as well as another great modulator of the blood vessels, allowing blood vessel flexibility. All these things are really important when you're trying to reduce someone's overall blood pressure, because you're trying to reduce that inflexibility in their vessels, reducing the pressure on their heart. So I gave him some very practical tips and tools, and I said, "You can try this, but I'm very worried. I don't want you to go away without the medications. I want to give you the medications. You can try this way of eating and see what happens. I'll bring you back." So he did. And then when he came back, I checked his blood pressure and my jaw almost hit the floor, because he'd gone from 180 over 100 millimeters of mercury, which is very, very high, to 120 over 80 millimeters of mercury, which is an ideal blood pressure. And I said, "What happened?" He said, "I did everything you said."
Oh,
I said,
it's
"And my blood
perfection.
pressure's come down."
Had he been also taking the medication, or had he just changed his lifestyle?
He had not taken the medication that I had prescribed for him. So I thought, this can't be something that he can maintain. This can't be real. So I said, "Look, come back again. I'll check it again in a few days." Sure enough, came back, checked it again. It was normal. I then brought him back in again so that he could have his medical to allow him to go back to work, checked it again. It was normal. And so I was almost as surprised as he was that he had such a dramatic improvement in his blood pressure. And of course, not everyone is going to have the same story. Not everybody is going to have such dramatic improvements. But for me, it was really interesting to see this change and to see this transformation within days, because it allowed me the opportunity to understand the power of plant-based nutrition in a way that I hadn't fully understood it before. And yeah, that was another really special moment for me. And of course, he was delighted. He got to go back to work, which made him very, very happy. And then he became, an advocate himself of being able to live a more healthy lifestyle.